Can you make it closer?
Okay, how about, I think I got it, yeah.
Okay.
I'm gonna do this, yeah. Okay, go ahead.
All right, welcome to the Western North Carolina School of Massage. My name is Hope Duvall, and today we're gonna be learning the therapeutic back massage. We're gonna begin with our client facing prone, lying face down, with their face in the face rest. Their ankles are bolstered. We're gonna begin by making some comfort touch. One hand resting gently on the sacrum, and the other above their shoulder blades, right in the center of their spine, where we take a few nice deep breaths and ask our client to take some deep breaths with us. So let's inhale and exhale. And during this time, we're tuning in, listening to the body, listening to the rhythm of the breath, and connecting. We're going to begin with some gentle rocking along the sacrum. We want to move the body to where we see the rocking translate all the way down to the ankles and the feet. Coming back up to the top, rocking the other side, starting in the hip, and gently rocking your way up the body. Undraping the back, pulling the sheet down, getting it out of the way. If our client has a waistband or an undergarment, you may feel it through the sheet. If not, we're gonna undrape their back to the gluteal cleft here. We're gonna pull out the arms and tuck at the side. Moving over to the other side of the body and repeating, doing the same thing again. To secure our drape, coming back to the head of the table, we're gonna take a pump of our massage lubricant and warm it in our hands, beginning with a heart effleurage 3 times, going all the way down the body to apply lubricant, back up and around the shoulders, all the way to the base of the skull. We're gonna repeat this step 3 times. You may need to apply more lubricant. Beginning at one side of your client's body, we're going to use our inside hand up and around the upper shoulder muscles, traveling all the way down the back, and light on the return. Making sure we're using our inside hand with our pressure applied down inferiorly towards the client's feet, and light on the return 3 times. Tracing the scapula with hand over hand. Again, 3 times. Just encircling the scapula. Stepping forward, pivoting with some petrissage or kneading to the upper trapezius muscle. Alternating hands, petrissage. And if we'd like to stop here and squeeze to compress, we can do so, holding for 10 to 15 seconds. Pivoting again, we are going to trace in 3 lines with thumbs or fingertips around the medial border of the scapula. So thumb over thumb, we're gonna glide just inside that edge of the scapula. We're gonna do this in 3 lines: medial, intermediate, moving slightly more towards the spine, and lateral. And here we're listening with our fingertips for whatever it is we might be feeling underneath the surface. If we find any little lumps or bumps in the tissue, any little tight spots or trigger points that might be the source or cause of someone's pain, we're gonna hang out there. This might be a great time to check in with our client regarding pressure. Would you like more or less pressure here?
The pressure's good.
Okay, great, thank you. If we would like to add more pressure, we would simply use our other hand, thumb on top of thumb, to increase the amount of pressure. Once we felt that spot let go or relieve tension, we're gonna apply friction by simply rubbing one surface over the other in a circular fashion. And move on. We may find anywhere from 1 to 3 spots in this spot that we want to compress on. So listen with your hands and see if there's anything here. Once we've released any of the trigger points in this region where the tissue starts to soften, we can move on. Transitioning to the lower back, we're going to use our inside hand to come up over the trapezius muscle, making sure we are staying clear of the spinous processes of the spinal vertebra, making sure to be aware of and not compress on the inferior angle of the scapula as we glide down and transition to the lower back, and gliding off in between the pelvis and the rib cage. I'm going to use thumb over thumb effleurage to affect one of the deepest abdominal muscles that we palpate through the low back, called the Quadratus Lumborum. This muscle sits directly beneath the rib cage and above the pelvis. So we're just going to use our thumbs here to glide in between this space and compress. Would you like a little less pressure here?
No.
Okay. Sometimes we'll feel a local twitch response when it feels like a muscle jumps. That's usually a good indication that we found a trigger point or an area that needs to be addressed a little bit further. If pressure allows, you can also use your broad forearm for a broad surface pressure in this region. Using a deep lunge stance, allow the base of your forearm to rest in between that space between the top of the pelvis or iliac crest and the rib cage. Make sure you relax your wrist while in this position. Smoothing this area out with hand over hand circles to the lower back. transitioning all the way back up towards the top of the back, repositioning yourself at the head of the table for hand over hand effleurage to the entire back. Three times. Back to the center, repeating the heart effleurage before moving on to the other side. We're going to repeat those same steps on the other side of the client's body. For the sake of the video, I'm not going to repeat all of those steps again, and I'm going to fast forward to the ending of our back massage. Once we've completed the other side, we're going to use our thumbs on either side of the spine in what's called the Lamina Groove. This is the groove of both sides of the spinous processes. You'll feel a little dip that follows the spine all the way down towards the pelvis. We're going to continue all the way down towards the sacrum. And push, gentle return back up to the top of the body. We can use thumbs or potentially our knuckles in an alternating knuckle pattern here. Or fingers. And again, light on the return, all the way up to the occiput. Once we have completed that portion of the back massage, we're going to replace the hands underneath the sheet and redrape. Where we're going to finish with some tapotement. Tapotement is the classic percussive techniques that most people are familiar with, the karate chops, which have a flat arm with the palm open. We are going to use tapotement. We're going to keep our wrists nice and loose and let the fingertips just glide the body. We can also use open fists. Cracking, or cupping rather, cracking. We just want to be mindful of the area where the kidneys are, right beneath the rib cage in the lower back. And finishing with the nerve stroke. Redraping. And that is our therapeutic back massage.